Hello, welcome to another episode of RAF series. Today we are going to look at a very simple topic. We are going to talk about investigating cerebellar functions. How do you know whether a person has a problem with his or her cerebellum? Let's find out. We are going to talk about several basic steps we can use to investigate that. Stay tuned as we move on. Now, the cerebellum is basically an organ that helps us in maintaining our muscle tone or regulating our muscle tone, helps us in balance and posture, as well as coordination of our muscle activity. So primarily we have the cerebellum, we have the neocerebellum, and then we have the paleocerebellum, which are responsible for these functions. With paleocerebellum responsible for our tone, neocerebellum responsible for the coordination, and then the cerebellum responsible for balance and posture. Now, if someone has a problem with his or her cerebellum, you would have to ask the person to do several or to perform several activities that will help you ascertain that. The first one we are going to look at is what we call tandem's gait. Now, how do you verify this? In tandem's gait, you ask the individual to walk. Now, but this type of walking will be such that if the right foot goes ahead, the left foot comes right behind it. So it's like you are walking in a straight line with each foot following the other. So if this one leads, this one will come behind it. So you appear to be walking in a straight line. Now, if you realize that the patient does this and then there is unsteadiness, then you can be thinking around the fact that the person could have a problem with his or her cerebellum. However, if the person does the tandem's gait and then it is very steady, then the person has no problem. So tandem gait is simply walking such that the foot or the feet of the individual or the patient follow each other in a straight line. If you realize that there is unsteadiness, and that means that the person might probably have a problem with his or her cerebellum. Now, the next test you are going to look at is the Rumberg's test. Now, Rumberg's test is a test that is responsible for basically investigating an individual's proprioception. Proprioception simply means that your knowledge of the position of the body. You can also use it to investigate an individual's sense of balance, the vestibular system, the position of the head, or the vision, because vision also helps us in balance. Now, in Rumberg's test, what you do is that you ask the individual to stand. So you ask the individual to stand with legs, with the 2 feet parallel to each other. Now, the individual must also make sure that his or her eyes are closed. So in Rumberg's test, you stand with the 2 feet parallel to each other and closed, and the eyes closed. Now, a positive Rumberg's test is when an individual closes his or her eye and then loses position or the sense of his or her positioning. So there is an increasing loss of positioning or unsteadiness. Then we say that the individual has a positive Rumberg's test. Now, how do we attribute it to cerebellar function? Now, we said that the test can help us basically to verify proprioception, which conscious proprioception is associated with the dorsal column. Is that okay? Now, but how do we associate it with cerebellar activity? If an individual performs a Rumberg's test and is positive, is that okay? If an individual performs a Rumberg's test and it is positive, that means that the ataxia, that's lack of coordination the person is experiencing, is probably a sensory ataxia. So that means that the person probably has a problem with his or her dorsal column. Is that okay? Dorsal column of white matter. So we are talking about the gracile fasciculus or the cuneatus fasciculus. But in the case where an individual performs a Rumberg's test which does not turn out to be positive, but the person still has ataxia, then you start to think about cerebellar functions. Is that okay? So it could be that the person is intoxicated out of alcohol. So you might not necessarily have a positive Rumberg's test, but then you experience some unsteadiness, then you realize that the person will probably have a problem with his or her cerebellum. Now the next one we are going to look at is what we call Didocokinesis. So Didocokinesis is the ability of an individual to perform fast alternative movement. It's usually associated with the upper limb. So for instance, my ability to do this. As I do this, remember I'm doing fast alternative movement. And this activity is mediated by the cerebellum. So in the case where an individual is unable to perform fast alternative movement, that is, we say that the person has this didocokinesis. So you are unable to perform fast alternative movement of your upper limb. So we say you have this didocokinesis. When you have this problem, it's probably associated with your cerebellum, that you have a dysfunction of your cerebellum. Another very important thing you must take note of is the tone in the muscle. We said that the paleocerebellum is responsible for the muscle tone. So in the case where an individual, you examine a patient's hand and then you realize that there is hypotonia, that's the muscle tone is very low, that okay? So hypotonia, and it's probably associated with cerebellar functions. Is that okay? So we've looked at Tandem's gait, Rumbeck's test, Didocokinesis, and then we've also looked at testing the muscle tone. So in the case of hypotonia, a very low tone of muscle, is that okay? Is associated with what? Cerebellar dysfunction, and also inability to be stable. So disequilibrium is associated with what? It's associated with cerebellar dysfunction. Is that okay? Now, so if you perform any of these tests and then you realize that an individual fails, then you can do further probing to find out whether, or to ascertain that the cerebellum of the person is actually not functioning. And remember that cerebellar activities are ipsilateral, so never say that cerebral activities are contralateral. They're actually ipsilateral for the body, and cerebellum is not responsible for initiating movement. Initiating of movement is an activity of the basal ganglia. Is that okay? So we've looked at Tandem's gait, Rumbeck's test, Didocokinesis, investigating an individual's tone muscle, in which case we said if an individual has cerebellar dysfunction, the person will experience hypotonia. Now the last one I want us to look at is what we call nystagmus. So nystagmus. You know that the cerebellum, through its archicerebellum, helps us to maintain balance and posture. And in the maintenance of balance and posture, the eye also plays a role. So through the vestibular system, that okay, information is sent to the cerebellum, and then fibers are sent through certain cranial nerves 6, 4, and 3, to actually control the movement of the eye in response to movement of the head. So in the case where an individual has nystagmus, that's to say that you ask the person to follow maybe a pen, you point at his or her eye. So if I'm able to follow this marker as it goes, check my eye as it moves, then if I'm able to follow it perfectly, that means I do not express any signs of nystagmus. But in the case where there is haphazard movement of my eyes, unsteady and then haphazard movement, then it's associated with what? Nystagmus, and that is also a sign of cerebellar dysfunction. So this is basically a short video helping us to investigate cerebellar dysfunctions, and then we look at Tandem's gait. We said we ask the person to walk such that each foot follows the other in a straight line type of thing. And Rumbeck's test, we look at that, and then we look at Didocokinesis. We said that in the case of cerebellar dysfunction, the person will experience this Didocokinesis. The person has hypotonia. So hypotonia, reduced muscle tone, nystagmus. Is that okay? So these are basically some of the tests you can use to verify cerebellar dysfunction. Like I promised you, it's a very short video that helps us to understand this. I hope this video was very helpful. Thank you very much.